Hi everyone, welcome back to my channel. If you have been following along, you would have known that I had promised to dive into a topic about a fish scale disease. However, I have decided to have that discussion for a future date when we have built a substantial community of subscribers. Instead, we will be discussing about a similar fish scale disease which affects millions worldwide, that is psoriasis. Welcome to Perfect Your Imperfections. Psoriasis is a chronic inflammatory skin condition that affects millions worldwide. It is characterized by red, raised plaques with silvery scales. It may appear on any part of the body. This occurs because hyperactive immune system speeds up skin cell growth. In normal skin, the skin cells grow and shed off within a month. However, in psoriasis, skin cells shed once in 3 or 4 days. The skin cells pile up on the skin surface. These plaques burn, itch and sting. These plaques may appear anywhere on the body. Psoriasis is less common in children and it sparks in the 4th decade and again between the ages of 50 to 69. Psoriasis is a non-communicable disease, that is, it doesn't spread from one person to another. It is a painful, disfiguring, disabling disease for which there is no cure. It affects negatively on the patient's life, but worry not, as I will help you manage it effectively. Visible signs of psoriasis include dry, thick patches of skin with scaling, itching, burning, and stinging sensations. These plaques commonly appear on the elbows, knees, and scalp but can affect any part of the body. It manifests as plaque psoriasis, palmoplantar psoriasis, nail psoriasis, scalp psoriasis, pustular psoriasis. Gutted psoriasis. This type of psoriasis is often seen as tiny bumps that appear on the skin. When gutted clears, it may never return. It tends to develop in children and young adults who have had an infection such as strep throat. Inverse psoriasis, where skin touches skin such as armpits, genitals, or at the crease of the buttocks where the inverse areas appears. You are likely to notice smooth red patches of skin that look raw. Nail psoriasis, you may notice tiny dents in your nails called nail pits. White, yellow, or brown discoloration under one or more nails. Crumbling rough nails or a nail lifting up so that it's no longer attached. Buildup of skin cells beneath one or more nails. It's important to pay attention to your joint, as some people who have psoriasis develop a type of arthritis called psoriatic arthritis. Now, what are the susceptibility factors? Behavioral and environmental factors clearly influence the course of disease in people who have a genetic predisposition to developing psoriasis. Smoking, alcohol, and obesity is clearly a causative factor. Some medications are known to worsen psoriasis, which include beta blockers, anti-malarials, interferon, etc. Psoriasis is associated with several comorbidities including arthritis, cardiovascular disease, depression, diabetes, or non-melanoma skin cancer. Let's look up at management options. First is lifestyle adjustments, which should include quitting smoking, limiting alcohol consumption, and managing stress through mindfulness, meditation, and cognitive behavioral therapy. Second is gentle skin care. Bathing in lukewarm water using low detergent-based cleansers such as soapless cleansers or glycerin-based soaps is an important first step. Harsh cleansing devices should be avoided. Moisturizing. Applying thick moisturizing creams or ointments, especially while the skin is still damp, will help. It will keep psoriatic skin soft and less vulnerable to itching and trauma. Natural oils such as avocado, coconut, almond, or olive oil can be helpful. Colloidal oatmeal in the form of an emollient or bath powder such as Aveeno can also help soothe itching and irritation. Third is dietary modifications. A plant-based anti-inflammatory approach to diet will help to promote weight loss. The ratio of omega-3 to omega-6 fatty acids is important, and it should include fatty fish like salmon, sardines, flax seeds, walnuts, etc. When it is not possible, supplements can also be helpful, example fish oil. Vitamin D levels were decreased in patients with psoriasis. Low serum calcium and zinc during pregnancy is known to cause Pustular psoriasis. Zinc can induce a copper deficiency, so 2 mg of copper should be added for every additional 30 mg of elemental zinc. Folic acid, vitamin D, and antioxidants can be increased by eating broccoli, green leafy vegetables, dried beans, peas, orange juice, and other organ meats and fortified cereals. The food sources of zinc are oysters, beef, poultry that is dark meat, pork, beans, and nuts. Now we look into the treatment options. Curcumin, which is the active component of turmeric. It has been shown to inhibit pro-inflammatory pathways. It is safe at doses up to 8 to 12 gram per day. Selenium, tropical botanicals like aloe vera contain an inner pulpy gel. These compounds have been found to have anti-inflammatory, anti-itch properties as well as pain reduction and wound healing. Aloe vera gel applied 2 times or multiple times a day or 0.5% extract in cream applied 3 times a day will be helpful. Indigo naturalist extract is one of the effective remedies for psoriasis. Dose is 3% to 7% ointment or cream or oil applied 1 to 2 times a day. Glycyrrhetinic acid is a compound from licorice root that has inhibitory activity on an enzyme to have anti-inflammatory properties as well. Mahonia equifolium is also known as Oregon grape or Mahonia equifolium contains berberin which has anti-inflammatory and antimicrobial properties. It can be helpful in treatment of psoriasis. It has shown to decrease psoriatic itch. 10% Mahonia equifolium cream once or twice a day can be helpful. Capsaicin. Itching is caused by a compound called a substance P which has been found to be higher and in skin affected by psoriasis. Capsaicin is a compound extracted from the red pepper that causes depletion of substance P. It has shown to decrease the sensation of itch. It can cause a burning sensation that usually lasts a few days with continued use. Use 0.25% cream applied 4 times a day or 0.75% cream is also available. Tropical over-the-counter medications like keratolytics like the salicylic acid, urea, alpha-hydroxy acids like glycolic acid and lactic acid in cream or ointment form are compounds that break down the outer layers of the skin. Tar-based products derived from coal or wood. It has anti-inflammatory and anti-itch properties, but it results in increased photosensitivity, that is, prolonged use in sun exposure areas can result in increased risk of cancer. Regular exercise and good sleep are important for all aspects of overall health. People who engage in various physical exercise for at least 3 to 4 hours per week gets ultraviolet exposure which help minimize psoriatic flares. And phototherapy is often used in the clinical setting for treatment of psoriasis. Spending time in outdoor activities may help improve psoriasis by UV exposure as well as by increasing physical activity levels. It's important to work with a well-trained and qualified homeopathic practitioner for possible homeopathic treatment. Psoriasis causes great physical, emotional and social burden. It affects the quality of life of the individual, especially the mental well-being, as we tend to see higher rates of depression impacting the quality of life of individual and the society. Social exclusion, stigma and discrimination are psychologically devastating for the individuals suffering from it and their family. It is largely the society's reaction to it that can impact the treatment for psoriasis. Remember, embracing your imperfection is a journey to self-love and acceptance. Don't forget to subscribe to my channel for more insightful content. Stay tuned for more tips and information on psoriasis management. If you wish to get personalized advice on any of your health concerns, be it physical or psychological, you can reach out to me on the email ID given in the description box below. See you in the next video.